Hi, everyone. Welcome to our first male infertility webinar titled Fatherhood, Planning with Sperm Tests, Overcoming Male Fertility Challenges and Optimizing Conception. I'm Viv, co-founder and CEO of Hera Fertility, where we provide at-home solutions for those who are trying and struggling to conceive. I'm joined with Dr. Darshan Patel, one of our clinical advisors here at Hera, and where today we're going to be covering a whole bunch of topics about male infertility. But just before we get started, Dr. Patel, thanks for joining us. Would love to get a little bit of background about yourself and what you do on a day-to-day basis.
Definitely. Thanks, Dave, for having me and this platform to kind of discuss this very important topic. My name is Darshan Patel. I'm a board certified urologist and I specialize in reproductive urology, which is kind of the study and management of male reproductive and sexual health. I'm an assistant professor of urology at the University of California, San Diego, where my clinical practice is primarily based out of. Um, Day to day, I mean, I see a lot of couples regarding fertility challenges. Um, Historically, a lot of the onus has been placed on the female side in terms of fertility and fertility workup, but it's very important to recognize that the male, makes up, 50% of the equation, and we know that in a significant percentage of the time, either the male alone or a combination of the male and the female may lead to challenges in terms of fertility. So for me, it's very rewarding to meet with these couples, kind of go through and work through their journey in terms of ultimately having a healthy baby.
Awesome. I'm super excited for today. So maybe to kick things off, the thing that a lot of my friends ask me about is what is male infertility? So maybe how would you define that?
Yeah, so I mean that's a great question. I mean, generally we kind of think about it as a couple, in a couple that the female partner is older than 35 years of age if they've been trying to conceive with unprotected intercourse for more than 6 months. We kind of define that as infertility.
Mhm.
And then in couples where the female partner, is younger than 35 years of age, it would be greater than 12 months. And that's an important distinction that, recently was changed over the last year, making it so that those couples that have an older female, they're being evaluated sooner. In terms of the male aspect of things, the most common thing that we hear about in couples coming in is if they've had a semen test that's been already completed and they have some sort of abnormality on that semen test, and a lot of that is kind of deciphering what's important and what may potentially affect fertility. Other things would be risk factors that men have or have had in the past in terms of things that may negatively affect fertility and their ability to conceive, if they've been exposed to chemotherapy, radiation treatments, other comorbid medical conditions, thyroid issues, liver issues, things like that. So there's a lot of folks that come in that may think they may have an issue in terms of difficulties with conceiving, may not, even be at that time interval in terms of 6 months or 12 months of trying, but want to kind of get more of a head start in understanding, what may come ahead. And, generally we do recommend being evaluated if there's something of concern in terms of specific risk factors.
Gotcha. And so you mentioned briefly about the test, the sperm test. It sounds like, is that the only test that men go through, and are there other tests? Yeah.
Yeah, so in terms of kind of the basic evaluation for men that we're seeing regarding fertility issues, I mean we kind of narrowed down to kind of three things. One of them is a good history and physical examination. That's where we're going to kind of dial in and figure out if they have any specific risk factors that may predispose them to difficulties with conceiving naturally. Physical examination, where we kind of really focus on the genitourinary examination, but we're looking for things such as varicoceles, making sure that they have both sperm tubes or the vas deferens, making sure the testicles are healthy and kind of the right size. Second thing would be the semen analysis, which for the most part is kind of the gold standard in terms of evaluation of male fertility. The challenge there is that the semen analysis certainly gives us an idea in terms of reproductive potential, by giving us several markers in terms of the number of sperm that are there, the amount of the ejaculate volume, what percentage are moving and how well they're moving. But it doesn't directly correlate with, chances of conceiving. Obviously there's algorithms and things that have been done that show us that, hey, if you're a specific number, you potentially have XYZ amount or chance of conceiving naturally. But the challenging thing there is that it also kind of, we need to consider the female aspect of things and making sure that's also optimized as well. Um, we still, that's, gold standard. There can be quite a bit of variability between semen analyses. So typically
Mhm.
we do repeat it multiple times, at least two, potentially even three, if the first one is abnormal. A lot of the, getting a good test essentially is very important because, like I mentioned, it is kind of the cornerstone in terms of the workup for male fertility. So it's important that, you're using kind of a reputable lab facility.
Mhm.
Third thing that we typically talk about is, kind of a brief endocrine workup or checking kind of the male reproductive hormones.
Mhm.
Um, that includes things such as testosterone and other reproductive hormones, such as FSH, follicle stimulating hormone, and luteinizing hormone. Even in men that are, largely asymptomatic, so they don't have any other issues in terms of sexual dysfunction or other things that may contribute to changes or maybe related to changes in those reproductive hormones. Sometimes we do find abnormalities, which, some of those guys may benefit from specific therapies.
Got it. Wow. And when should they, I remember you were mentioning a little bit about the age of the woman and when they would be getting tested, but like when should a guy be getting it tested and doing maybe the sperm test to get started?
Yeah, I mean, that's a great question. I would say that there really is no specific age. It really depends on whether or not, it's of importance to you. Obviously, we see those couples and men that, have been trying and, have not been successful. But we also see probably an equal amount of men and couples that, they're about to start this journey and they want to kind of make sure that they're well optimized or set up to be successful. Because, obviously, there is a very significant emotional toll in terms of fertility challenges. And for a lot of men and a lot of those couples, it's nice to know that, hey, from the get go, we are largely optimized to try naturally, and if
Mhm.
that's the route that we're going to go, great. But if there is something abnormal or something that we can optimize, is there something that we can do differently to make the chances of success higher? And the big thing that we talk about, at least in terms of fertility, is time.
Mhm.
And that's where the idea of age comes in. So we're seeing folks that are kind of delaying, having children, for
Mhm.
whatever societal reasons or, their career or whatever. But the challenges there, we're very well familiar with the impacts in terms of the female side of things, where, their reserves go down after a certain age, can increase the chances of certain medical conditions in the offspring. But on the male side of things, that's not as well understood. There is significant um, research that's been done that suggests that men that are over the age of 40,
Mhm.
they are at a higher chance of their offspring being diagnosed with certain neuro psychiatric conditions such as schizophrenia, autism spectrum disorder.
Mhm.
And that's something kind of that's newer, where initially it was thought that men are always generating sperm even as they get older. You hear about Al Pacino, he's 80 something, whatever, he's having kids. It's still possible, but the other unique challenge there is what's the health of the offspring in men that are older, and that's kind of an area that area of research that definitely is kind of growing. But we do know that there certainly can be some implications in terms of or negative implications in terms of the health of the offspring in older fathers.
Gotcha. Now, going back to the test, if someone does go through this test and let's say they get results like poor sperm quality or not so good news, what are some of the common treatment options that they have?
Yeah, so I mean, when we kind of think about causes in terms of changes in the sperm production or numbers, we kind of just divide it into production issue or more of an obstruction issue.
Mhm.
There are a lot of things that kind of factor into each of those, but it's important to figure out, whether or not it's one or the other. There are certain things that can be done for specific issues or causes, and other things that we kind of group into either idiopathic male infertility, where basically everything is largely normal, but you're still having a hard time conceiving, or unexplained male infertility, where they have some abnormalities in their semen analysis, but there isn't anything really identifiable that would, suggest what's going on.
Mhm.
In the kind of day to day our clinic, I would say a big risk factor or thing that we see in patients is obviously kind of lifestyle considerations.
Mhm.
So, everyone asks about this, and I think it's a very important aspect in terms of optimizing fertility. But looking at smoking. So obviously, most people are aware that tobacco exposure is bad, and certainly is bad in terms of sperm health and being able to conceive. Um, here in California, one of the things we commonly hear about is, what's the deal with marijuana and cannabis? Historically, everyone thought that, if you're smoking, marijuana, that's obviously bad, similar to kind of tobacco exposure. But, other things that, are THC based edibles, things like that, that's probably okay. But I would say over the last few years, I mean, that's kind of changing where now there's, some data, some of it's animal data, but that suggests that um, exposure to even THC can kind of change things in terms of sperm counts, sperm motility, as well as kind of other things in terms of the way that the DNA gets kind of packaged within the sperm that may increase the chances of a lot of those neuropsychiatric conditions that I was talking about earlier.
Gotcha.
Um, Alcohol, a lot of guys, especially of reproductive age, they go out on the weekends and they enjoy
Mhm.
themselves. Certainly in moderation, it's probably okay. But men that are kind of binge drinking on the weekends, that's similarly can negatively affect hormone production, and that in turn could affect sperm production. Um, you know, Excessive heat, it's another common thing that we kind of get asked about as well. So if you're spending a lot of time or prolonged time in saunas, hot tubs, and then folks that use like a laptop computer, that could potentially negatively impact sperm production.
Mhm.
And then healthy maintaining a healthy weight. So a lot of guys understand that, being active and kind of focusing on a good balanced diet is going to be important, but it's important for us as healthcare providers to kind of reiterate that to them in the frame of the fertility discussion. So we typically say, try to get out and exercise, fairly regularly, 3 to 5 times a week. In terms of diet, trying to avoid a lot of processed or, heavily foods that have kind of heavy saturated fats or processed sugars.
Mhm.
And it's really just kind of making those small changes overall that can help maintain kind of a healthy weight. Um, Last thing that I would say would be something like a varicocele. I mean, that probably makes up in our clinic when we do that examination, probably 50% of the patients that we see, have a varicocele. The
Mhm.
challenge there is that varicocele itself is a very common incidental finding. If we grab, 100 guys out of this, off the street, there's probably 15 that have a varicocele, but not all 15 are going to have issues in terms of fertility. But in our clinic, it's kind of biased, where
Mhm.
most of those couples have been trying for a while and have not been successful, and as a result, we notice that they do have something like a varicocele. What a varicocele is, basically, it's kind of a collection of dilated veins or the vessels that carry blood away from the testicle towards the heart.
Mhm.
The challenge, with varicocele is that the blood that's in the veins isn't pressurized compared to like an artery. So it relies on these little valves to help push the blood back towards the heart. Those valves can become, incompetent or don't function that well, similar to folks that have like varicose veins or spider veins in their leg. The challenge in the testicle is we kind of think about it as the radiator's not working, where that extra blood that's sitting around the testicle kind of every day increases the temperature of the testicle. And generally, the testicles like to stay cooler than the rest of the body, and that's why they generally kind of hang a little bit lower and are able to kind of change the temperature, independently of kind of what your overall body temperature is. But that extra heat negatively affects sperm production, sperm motility, and there's very good evidence that suggests that.
Mhm.
Um, so that certainly is another, risk factor, at least in terms of men that have changes in their sperm production or have been trying for a while and have not been successful in terms of conceiving.
Gotcha. Wow. Just on that one, like, what is the common treatment there? Just a minor procedure, or are there some medication they could do?
Yeah, so generally in terms of varicocele, it's going to be treated with some form of procedure. The gold standard really is what's called a subinguinal microscopic varicocele repair, which gets done through a small little, 2 centimeter groin incision. And then we use a surgical microscope to repair those varicoceles. There's other options in terms of varicocele repair. They kind of have some of their limitations in terms of how well they work and other side
Mhm.
effects, but generally, most reproductive urologists would advocate for kind of a microscopic repair of the varicoceles. And I would say generally, it's not a guarantee, but most, before and after repair, generally the way that we counsel men and couples is that about 70% of men can expect an improvement in one or more of their semen parameters after varicocele repair, but it can take some time. So usually that optimal window of when the best sperm is going to come out is going to be about 3 to 6 months after a varicocele repair. And generally, that's because that's how long it takes for the sperm to kind of mature and kind of go through the whole system. Um, and for some couples, it makes sense in terms of trying to optimize, the male aspect of things and undergo that sort of repair. But we also want to kind of consider the female side of things. If there's some other female factors at play, and they're kind of headed in the direction of doing, some form of escalation of their therapy, like intrauterine insemination or
Mhm.
IVF. Varicocele repair may or may not necessarily make sense, especially if the female partner's age is, older. If they're above the age of 37 or 40, or kind of those typical ages that we think about when their ovarian reserve starts to kind of go down.
Gotcha. So that's why it's important to kind of see both partners and make a figure out what is the right option from there. Do you tend to see that in your practice a lot, where you're reviewing and talking to both partners?
Yeah, exactly. And we love when kind of both partners come to their appointment, because it's helpful to kind of understand both sides of care. It's also important for us as reproductive urologists to work very closely with the female side and kind of the doctors that kind of manage a lot of female fertility issues in terms of, the gynecologists and other reproductive endocrinologists. But I would say, even nowadays, it's tough, working age, couples, it's tough to make kind of a 9 a.m. appointment. And that's where, telehealth platforms has really improved access to kind
Mhm.
of, reproductive urologists, where, both partners can be there because they can kind of shell out, 10, 15, 20 minutes for an appointment that they could do virtually rather than kind of physically going in person to an appointment.
Gotcha. I have a few more questions. The big one that we kept hearing from others when we polled was this whole world of vitamins and supplements. Because a lot of people want to be a little bit proactive there. Where's your take? What's your take on the men's side and the supplements?
Yeah, so I would say the simple answer in terms of supplements and antioxidants for overall is that there's pretty limited evidence that suggests that they work,
Mhm.
and that's largely based on kind of two studies that came out over the last couple of years that were very well done that did not show a significant difference in terms of improving semen parameters or improving the risk or the rates of pregnancy.
Got it.
Um, that being said, there's a lot of interest in various antioxidants and supplements, most of which are available over the counter. There have been some small studies that have suggested benefit. Generally, for us, if someone's eating kind of a balanced diet, in
Mhm.
addition to kind of just a simple multivitamin, um, we've recommended things like coenzyme Q10, L-carnitine. They're probably the most robust in terms of studies that have suggested some improvement, at least in terms of semen parameters.
Mhm.
Um, and consideration there is that generally there may be some marginal improvement that we may or may not see, but generally they're going to be fairly safe. It's very unusual or very unlikely that it's going to cause significant adverse effects or interact with other medications that you may be on. But it's still an important discussion to have with your doctor in terms of selecting one of these supplements that you may or may not get. Because on the flip side, we also see guys that they go to GNC and they see an ad for like a testosterone booster, and there's a
Yeah.
lot of ingredients in those kinds of things that probably negatively going to impact fertility. So it is kind of a tricky thing, and should be kind of done under the guidance of kind of a fertility provider.
Gotcha. So just on that one, do you recommend your patients to share like the supplements and vitamins just so you have a full picture?
Oh yeah, and that's kind of a key component of that history that we take as well. So we're
Right.
definitely interested in any prescription medications that you're taking, which for a lot of reproductive age males, it's usually nothing. But whatever supplements, over-the-counter things that they may be taking as well, and that includes everything workout-related things that they may be taking, protein powders, other vitamins, minerals, phytotherapy or plant-based therapy that they may be taking as well. So, we're interested in all those things, really just kind of get a very comprehensive and holistic view about, potential risk factors that may either positively or negatively affect their fertility.
Gotcha. Well, to close this off, I'm curious, like if our people who are watching this, they're probably curious, what can they do? What's kind of like the most important tip you would share with them? Because I think you've shared a lot, but what's kind of like the number one thing that you want them to leave with?
Yeah, so I would say in terms of improving or optimizing fertility, just lifestyle changes is probably the most important thing they can do early on. Or if you haven't had a sperm test already that demonstrates that you have some abnormalities, and those things like we've already mentioned, would be kind of avoiding smoking, avoiding marijuana, alcohol in moderation, and maintaining kind of a healthy weight. I think those three things in terms of lifestyle considerations is probably the most important. Um, like we mentioned also before, there's going to be specific risk factors or in men that have already had a semen analysis that demonstrate there are changes. That's going to be kind of in a different ball game because for us, at least on the male side of things, our
Mhm.
goal really is to try to optimize men to be able to conceive naturally, or if other therapies are required, what can we do to increase those chances? So, when we see those risk factors, we want to try to optimize them. That's something simple that can be done, at home even before you've seen a provider. We talked about kind of vitamins and supplements. Kind of do your research, but I would say generally we don't routinely recommend them, but there are certain patients that may benefit from them.
Mhm.
And then making sure that you have kind of some good baseline testing. So the cornerstone of our workup typically is that semen analysis.
Mhm.
And ensuring that you have a good sample, good results, and good testing is important because a lot of the decisions that we make in terms of how to best optimize you is based on that semen analysis.
Gotcha. Well, I hope that all the men who are listening are going to get that initial test done, and ideally with their partner at the same time while they're getting the testing, so that at least we can have a good baseline and see what needs to be done. But I think there's a lot of good nuggets out of this, and I'm excited because what I've learned is more education needs to happen. So
That's right.
I'm hoping everyone learns a lot from this. And if you guys have any questions, feel free to reach out to Hera or Dr. Patel. But thank you, Dr. Patel, for spending the time out of your busy schedule for giving us some wisdom here.
Yeah. Thanks for having me.
All right, take care.